Do you ever have pain with sitting? Do you have pain in your sit bones or maybe in your tailbone? Do you avoid social situations when you have to sit? Are you constantly explaining to your friends and family why you won't sit at social gatherings? Well, if you answered yes to any of those questions, you should stick around for the rest of this, because today we are going to talk about cushions. As a pelvic floor therapist, many of my patients report pain with sitting. Some of them report pain in the ischial tuberosities or in the sit bones. Others report pain in more the genital region, and then others report pain in the tailbone or coccyx or around the anus or perianal region. So there are various cushions available that could help you sit more comfortably if you have pain in one of those areas. Because as we work through the muscular and neuropathic impairments, it's important to continue sitting as much as possible. So patients always ask me, well, which is the best cushion for me? And the answer is the best cushion is the cushion that gives you the most relief. And that may depend on where your pain is. So the first cushion we're going to talk about is the Thera Seat. Now the Thera Seat comes in 3 different cutouts. Now this is the oval cutout, which I will remove the covering. And as you can see, it has an oval cutout. Now this cushion also comes in more of a round cutout or also a cutout in the back of the cushion. Now this cushion may be good for someone who has various kinds of pelvic pain. This oval cutout could be good for someone who has genital pain or anal pain. The Thera Seat with more of the round cutout, which would be a little wider cutout, could be good for someone who has pain in their sit bones or ischial tuberosities. The Thera Seat with more of the cutout in the back of the cushion could be good for someone who has more tailbone pain or possibly anal pain. These cushions are also good for folks who suffer from pudendal neuralgia, as sitting pain is a very common symptom of those with pudendal neuralgia. Now this seat is available online and will cost you about $90. The next cushion we're going to talk about is the Kabuti Cushion, and that is Kabuti with a K. Now this is the cushion, and it has 2 cutouts, one in the center and one more towards the back. So we'll remove the covering so you can see a little bit better. So as you can see, it has a cutout in the middle as well as the back. So this cushion may be better for those with more perineal, genital, or coccyx or tailbone or anal pain. This is definitely the more economical option for cushions, as it is available online for about $30. The next cushion we're going to talk about is called Cushion Your Assets, and I will say this is a patient favorite. Now this cushion has 2 panels that are held on by very strong Velcro. Now you can put these panels as close together or as far apart as you want, or even rotate them depending on where you want the pressure relief. If you want it more towards the back, you can put it farther apart like that, or if you want the pressure relief more towards the front of your pelvis, you could put them in this configuration, or if you wanted to leave more space for your sit bones, you could put them farther apart. This cushion comes in 3 levels of firmness: medium, firm, and extra firm. This is a firm one and is available online for about $100. The next cushion we're going to talk about is called the Tushkush. Now the Tushkush, as you can see, has a cutout in the back of the cushion and was designed specifically for folks who had tailbone pain and or anal pain. This cushion is available online for about $60. The next cushion we're going to talk about is a cushion from the company Purple. Now you may know the company Purple for their mattresses, but they also make cushions. So this cushion is this, obviously, purple cushion, and this cushion does not have a cutout, but it has these little silicone cells that are pressure relieving to evenly distribute your weight to make it more comfortable to sit, which can help relieve pain in those painful areas that you may have. Now this cushion comes in various levels of thickness. There's a travel or thin version, which is available for about $40, Or this version, which is a thicker version, they come in thick to very thick for long extended sitting from $80 to about $130, and they are available online. So the last kind of cushion I want to talk about is a DIY, or do-it-yourself. Some patients find that none of these cushion options that I've talked about today really work for their particular pain. So some ideas for you are purchasing garden kneeling cushions, which are about 10 to 15 bucks online, and then you can cut out the areas that you would need to provide pressure relief for your particular pain syndromes. Some other options are many patients, particularly with prenatal neuralgia, say that their most comfortable position is when they sit on a toilet seat. So some folks have actually taken a toilet seat as the pattern and created a foam cushion around that. So at the end of the day, as you can see, there's no one size fits all. Everyone feels a little differently about the cushion that they find that helps them the most. So I would encourage you to try them out. If they don't work for you, return them and try another one. Or if your PT office is like ours, borrow one of their cushions, see how it fits you, and then return it to them. If you have a cushion that's worked really well for you that we didn't talk about today, please tell us about it. We'd love to know. Thanks so much. Bye-bye.